I'm Dr. Ryan Lombardo. I'm an acupuncturist and I have a doctorate in Oriental medicine. I'm board certified in acupuncture, anti-aging, and integrative medicine. I focus mostly on inflammatory conditions, and that is a wide range of health issues, including pain relief, diabetes, heart disease, thyroid disease, very specifically weight loss, and the reversal of many things like metabolic syndrome and type 2 diabetes and a lot of the risk factors that go along with age-related disease. I have a pretty diverse background in biotechnology and research, and a little bit of early stuff right out of school, but I originally got my bachelor's degree in psychology and a certificate of business from University of Wisconsin in Madison, and right out of school went to work for a biotechnology company that focused on diabetes and cardiovascular disease. During that time I was introduced to a series of chemists, physicians, and other people in the industry that were very interested in herbal medicine and alternative forms of treating these types of diseases, because Western medicine was failing in a large number of cases. Medication was very good at altering numbers, but there are a lot of side effects, and there were a lot of side effects in the early rounds of those medications that made it difficult for people to stay compliant. And when I saw the results that were going on with some simple and more common herbs like milk thistle and Chinese red yeast rice, I spoke to a few people and reached out to a few physicians I knew, and they encouraged me to go into a master's program in Oriental medicine or something similar. So I moved back to Chicago. I did those things and finished out a master's program, about 12, 13 years ago already, and it really changed the course of my life. I originally thought I was going to graduate and go help pharmaceutical companies buy herbal companies. I thought that was going to be the way that my career was going to go, but in my clinical education and in 2 years of residency, it was very hard for me, or 3 years residency, it was very hard for me to stay down that corporate path. I just saw results for people that had been trying for years and years. They'd been everywhere, different doctors, different hospitals, different specialists, and all of a sudden this ancient medicine, acupuncture, herbal medicine, micronutrients, was life-changing for them. And it guided me towards more care and more treatment care. And I was, in my early to mid-20s, when I was in school, and gravitated towards a pretty specific population of people that were, already feeling the effects of age-related disease, but they were feeling those effects between their 20s and their 40s. And so I realized right then that this was going to be my specialty in preventing disease instead of treating symptoms. And I came out, I started practicing in downtown Chicago, and throughout a few years of practice, I really tightened my scope into things like thyroid health, weight loss, cardiovascular disease, diabetes, and dermatology actually. And dermatology was kind of an offshoot in the beginning because people were coming in with issues that were showing up on their skin, people wanting facial rejuvenation, cosmetic acupuncture, people wondering about certain rashes, eczema, psoriasis, things they were struggling with finding a Western medicine cure. So I really found an interesting niche and started to work in research, in dermatology research, and found that Western medicine and Eastern medicine blend very well for those types of diseases, because they are essentially diseases that don't have cures but need to be managed. And long-term care from an Eastern or integrative medicine perspective is significantly safer than long-term care from a Western medicine perspective only. So I've found, luckily, an excellent partnership with Freshkin and Dr. Josie, where we can really provide those types of services in a setting together.